Welcome everyone. Thanks to those who have joined. We will go ahead and get started in a minute here. Welcome everyone. Thanks to those who have joined. We will go ahead and get started. Good afternoon, buenas tardes, welcome, bienvenidos. We will go ahead and get started for our first provider information session of 2023. Welcome back, everyone. Thank you for joining us on this evening. It's been pretty rainy on my side of the woods. Hopefully you all are easing into this 2023 with some rest, is all I can say. In our next slide, we'll go ahead and just give instructions for our interpretation tools, just to make sure that everyone who is here can access these before we dive into the information we have available for you tonight. Si usted habla español, por favor, presione el icono que tiene en la parte de abajo de su pantalla para que pueda elegir el idioma y escuchar a nuestro intérprete que está aquí hablando español. So just give it a second for anyone who might need to transition over. All right. I think we're ready to get going. Again, welcome. Thanks for joining us. We have a pretty robust agenda this afternoon, lots of great information that we wanted to share and allow you to ask questions on as well. We see that here, the agenda, we will be covering a little bit about the 2023 legislative session. We have our director, Alyssa Chatterjee, here with us again, who will overview this as well as the DELC timeline and overview, our transition to the Department of Early Learning and Care. We will have agency and program updates after this. Our agenda is a little flipped here. We had made some final tweaks just minutes before getting started. And we'll actually close with our capacity information about the capacity building grants from Seeding Justice. So we'll have a guest with us who will join us to provide information about these upcoming grants. And as always, we'll allow for questions after each topic. If you are joining us on Facebook, please know that we do have ELD staff watching the chat there to try to address as many questions as we possibly can through this hour via Zoom. And if you need language access, please access the Zoom link that is available on that Facebook page as well, so that you can have ASL interpretation access there, as well as language interpretation. With this, I'd love to hand it over to Alyssa Chatterjee, our Early Learning Director, to walk us through what is coming up for these next 6 months.
Thanks, Karina. Good evening, everyone. My name is Alyssa Chatterjee. I am the Early Learning System Director with the Early Learning Division. Excited to share some updates with you all in the new year. So we wanted to make sure everyone's aware that we are getting ready to enter into the legislative session. So this is the time when our budget is going to be set for the Early Learning Division and the Office of Child Care. And when we see new investments, we talk about policies and a lot of opportunity for involvement. So back in September, we submitted our first agency request budget as we become the new Department of Early Learning and Care, which I'm excited to talk to you all about this evening. So this included investment requests, priorities for us as we become a new agency, and really an opportunity to share what we want to focus on over these next 2 years. This would be for our budget that starts July 1, 2023, and goes through June 30th, 2025. So we talked about the need to really make sure that we have the right infrastructure and capacity to provide you all with the level of customer service that you need and should expect from us. We want to make sure that we're providing enough resources to our providers and partners who are receiving funding from us through programs like Preschool Promise or Oregon Prenatal to Kindergarten or the Early Childhood Equity Fund. And we want to continue providing those supports to our early learning providers throughout the state. So this will all come forward through the legislative session. The session begins next week on January 17th. It will go through June 25th. This legislative session will look a little bit different than the last full session that took place in 2021. So there's a new committee, the House Early Childhood and Human Services Committee, that we'll be working really closely with. We also will work closely with the Joint Ways and Means Subcommittee on Education. So this House committee is going to be the primary place to talk about policy ideas and talk about legislation and bills. The Education Subcommittee is where we'll go to talk about budget. So what will the budget of the agency look like? What would it cost to invest in new policy ideas? As an agency, we're waiting on the governor's recommended budget. So Governor Kotek was sworn in on Monday, January 9th, and she has to release her recommended budget by February 1st. That will really determine what budget and legislative requests we can support as an agency. And again, this will be a fast and furious 6 months as the legislative session ends by June 25th. So early learning and childcare bills, there are a lot of them that are already coming out. So we think most of this legislation will go to that House Early Childhood and Human Services Committee. This committee is comprised of members from the House of Representatives, and they'll be focusing on early learning, childcare policy, as well as human services policy. But there are also bills that may end up in the House Education Committee, the Senate Education Committee, or other committees that may seem more appropriate. It's up to the Speaker of the House and the Senate President to decide where each bill goes. So we don't have a choice in terms of where the legislation ends up. If you want more information about this process, about these committees, who's on the committees, if you want to know who your legislator is, we have a link here. You can go to the Oregon Legislative Information System. Again, session won't start until next week, but if you want to learn more about who sits on each committee, if you want to keep an eye on agendas and hearings, you can do so there. We're already preparing to join the House Early Childhood and Human Services Committee next Wednesday for their first committee meeting. So we plan to spend a lot of time with that committee, and you can always tune in and listen to those hearings, or every hearing is recorded if you feel like listening in on that in the evenings or with all the free time that I know you really don't have with all the incredible work that you're doing. But that's all available for you, as well as any presentation materials or other reference materials that may be of interest to folks. So I can pause there if there's any quick questions about the legislative session. I don't think we have any in the chat, but I'll give folks a minute if something comes up for you. Okay, we'll keep going and happy to answer any questions that do come up for folks. So we wanted to talk about the Department of Early Learning and Care that I mentioned. We're calling it DELC, and talk a little bit about what you can expect with this change. So I know this is a very busy slide, so we'll kind of break down each section. So first, we wanted to talk about why. So we're in the process of shifting from the Early Learning Division and the Office of Child Care. We're currently part of the Oregon Department of Education, and we will now be the Department of Early Learning and Care starting on July 1st. So this really was something that is required, but really is an opportunity. House Bill 3073 was passed by the legislature and signed into law by the governor in 2021. It requires that we create this new Department of Early Learning and Care, moving all of the programs and functions of the Early Learning Division into this new agency. And the idea was to strengthen Oregon's early learning system and really think about a central place to better serve Oregon's children, families, providers, and partners. And you can see here, we're taking two major pieces of the Oregon Department of Education, the Early Learning Division and Office and Child Care, and we're merging some other key functions from the Department of Human Services. And that's employment-related daycare, which is our child care subsidy program, the direct pay unit that's responsible for issuing payments for ERDC, and the Inclusive Partners Program. So what's the benefit? The hope is that really bringing these 5 agencies together will help us create more efficient services and use resources more wisely. It will also allow us to find those efficiencies and work better together and reduce any duplication of efforts. The hope is that this will actually help us increase the supply and availability of culturally responsive childcare and early learning, because our programs will be more accessible, they'll be more coordinated, and it will be easier to access these supports and resources. From there, we hope to be able to increase the number of families that can access our services and ultimately deliver fairer services for families, children, and providers throughout the state of Oregon. So if you're a provider, the goal and the hope is that DELC really will be a better system for you all to access, whether you're licensed or license exempt. This would mean more training opportunities for license exempt providers, because we'll have the employment-related daycare subsidy program in one place, as well as access to other supports. We're also hoping that this will expand the types of providers that will be in one place. And so this will allow us to really promote what we've called that mixed delivery model, and make sure that school age programs, infant toddler programs, preschool programs, license and license exempt programs are all working together, and that we as an agency are setting policies and direction in a more consistent way, so that it's easier for folks to be able to access services and supports going forward. For programs that currently exist or that you might interact with, like Preschool Promise or Baby Promise, this will not change the way programs are administered. So they are moving with us. You can expect to work with the same folks, but we are taking this moment to see if we can administer those programs more efficiently and more consistently. And then the hope ultimately is that by organizing our services under one agency, children and families will have an easier time finding these services and accessing supports going forward. And I'm seeing a question in the chat that I'll go ahead and answer real quick. The Head Start Collaboration Office is currently in the Early Learning Division and will come over to the Department of Early Learning and Care. So you shouldn't feel that change. We're still going to be the same folks supporting you. We're just going to be bringing some other programs into the fold and being more intentional about coordination going forward. The last big piece that was part of House Bill 3073 was employment-related daycare. So one of the goals was to move this program from the Oregon Department of Human Services into the Department of Early Learning and Care, so that our early learning programs, childcare licensing and compliance, and childcare subsidy sit in one place. So this actually expanded eligibility for the program and creates a guaranteed 12-month eligibility. It caps family copays to make sure that they're no more than 7% of family income. This took effect back in October. This will allow for more financial incentives for providers to offer services. We also will be looking at a different way of calculating subsidy reimbursement and looking at the true cost of care. And finally, making sure that providers are reimbursed based on enrollment and not attendance. So this means that a regulated subsidy or licensed provider who accepts ERDC can bill at the start of the month rather than the end of the month. So those are some really exciting changes that we've been in the process of implementing and are just some examples of the way we're trying to administer this program differently and make sure that we're, again, being coordinated, reducing barriers, and making these programs work better for providers and for families. Zakia, I see your question as well. So the ORO system will continue to be administered by OCCD, but we're taking that contract with us. It will still be overseen by us as we become the Department of Early Learning and Care. So thank you for that question. The last piece I wanted to share, there's a lot of moving pieces when it comes to creating this agency. And this has been in the works since the legislation was passed in 2021. So back in the summer of 21, we wanted to look at how things were operating now when it came to the employment-related daycare program. So we did some really intentional work to look at what systems we had in place, what processes and policies were being implemented, and where there were opportunities to improve the administration of the ERDC program. Starting in the fall of 21, we then looked at the Early Learning Division's current state and where there were those opportunities for process improvement and coordination, and used this to really think about the design of the new Department of Early Learning and Care. We also looked at other states that have early learning agencies like New Mexico, Georgia, to see what they've done and where we have that opportunity to learn from the great work they've already completed and the lessons they've learned along the way. From there, we entered this design phase. So we started to look at how we would move the ERDC program and other childcare programs that sit in the Department of Human Services. We want to make sure nothing breaks, this is as painless as possible, and that you all only notice improved operational changes. We started looking at our mission, vision, values, and some of you helped weigh in on the development of those through surveys, and really want to appreciate you all taking that time. We started drafting our organizational model and preparing for the new functions that will sit in DELC, like procurement, budget, accounting, human resources, that had previously been a part of the Department of Education. We looked at the budget impacts, and then we started talking about building this agency. So we started planning for policy transitions. We're in the process now of establishing processes and procedures, and we'll be reaching out to some of you to find out, how can we make our systems work better? How can we make accessing resources and dollars easier? What would it take for you to want to apply for Preschool Promise? What would it take for you to want to participate in ERDC? And we're making sure that we're bringing our staff along so that they're ready to help us implement the Department of Early Learning and Care on July 1 once we launch. And I see another question in the chat around ERDC intake. So Peggy, great question. We do not want to reduce access to ERDC. So folks can continue to apply to determine if they're eligible through those ODHS field offices, through the One Integrated Eligibility System, continue to work with their child care resource and referral partner if they want to learn more about becoming a listed provider. So we will not be removing any of those access points in helping families find out if they qualify and helping child care providers become listed. Thanks for that, Peggy. Any other questions folks have about this new Department of Early Learning and Care? You also might have participated in a flash survey we did before the end of the year to help us pick our logo. So we're in the process now of finalizing that. Lots more information that will roll out in the coming months as we get closer to becoming the Department of Early Learning and Care in July.
Alyssa, I do see a question on Facebook.
Great.
The question is about school district preschools and how those will be monitored under DELC. Can you speak to that at all?
Yeah, great question. So there's a little bit of nuance here. If a school district is funding the preschool program, then we do not currently oversee those programs. We'll continue to work with the Department of Education to set some quality standards, because we know that families expect a certain level of quality when a trusted partner like a school district is offering services. But we do not oversee school district funded and operated programs. If a school district has a program and they're say renting space to KinderCare, we would continue to license and monitor those preschool and early learning programs. Or if they're receiving preschool promise dollars for their program, we'd continue to monitor those programs as well.
Thank you, Alyssa. I'm not seeing any additional questions on Facebook or in the Q&A. We can give it another. Oh, yeah, we have two questions now, Alyssa, about the Central Background Registry. I know that wasn't on your agenda, but we'd love to address those if we can. The first question asks, may we please have an update on how long it's taking to get someone enrolled in the Central Background Registry? And the second asking if the CBR timelines are expected to improve with the change to the Department of Early Learning and Care.
Great questions, and thanks for flagging those, Allison. So absolutely, we know that these Central Background Registry timelines are making it impossible for you all to do your jobs as providers and putting families in impossible situations when you have to close your doors because you don't have enough staff. So we are continuing to work on this. We have actually been doing a lot of major hiring. So we have more than doubled our background check and customer service team in the last 2 months. We've grown from 19 staff to 40. We had our first in-person training session last week and are continuing to train those staff over the month of January to really have them prepared to be responsive to your needs and continue to help us work through the backlog. We have a little over 1,200 applications that are currently in the process or that have not started to be reviewed. So while we've made significant improvements from the 5,500 applications in our backlog, we know 1,200 applications is still far too many. We are currently now down to about 8 weeks for enrollment in the CBR, which again, we know is far too long for folks. Some folks may be enrolled conditionally in the CBR sooner than that, but again, we know that's not always helpful when they can't count towards ratio and can't have unsupervised access to children. We do anticipate some improvements to this through DELC. They may take a little bit of time, so we have two approaches. Right now, we've been focused on staffing and getting more folks on board to help us get through this backlog and to create systems in place to prevent future backlogs from coming up for us, especially as we get prepared for the summer months. We're also looking and leveraging some of our new staff in our project management team to find system efficiencies and see if there's anything we can be doing to make this process easier for folks to apply and easier for our staff to process these requests. Finally, we've also been working with Region 10, so with the Federal Administration for Children and Families, to see if other states are doing this better and if there's some changes we can make to make this process easier. As you become DELC, there's a really big project that we're going to be starting on, and that is for a provider management platform. So this will replace the payment function that ODHS currently uses to pay providers who accept ERDC. It will replace our licensing system, and ideally it will allow us to have a much better system for tracking background checks. So that likely won't take effect until 2024, but we're hopeful that with these staffing changes, you all should start to see the effects of that major staffing lift and see those timelines go down. In the meantime, please reach out to your licensing specialist or your CCRNR if you have individuals who are still waiting for their background checks to clear and it's been close to that 8-week mark, or if you're at risk of having to close your program because of background check delays. We want to do everything we can to keep your programs open, and your licensing specialist will make sure we elevate who you're waiting on and see if we can get those expedited. I see the question in the chat too around Office of Head Start. We do know that the Office of Head Start has said conditional enrollment in the CBR does not meet Head Start performance standards. We are working with the Federal Office of Head Start as well as our background check staff to make sure we're aware of any Head Start or Oregon prenatal to kindergarten staff who are going through the application process. Great question, Becky. Could we have those who are waiting be conditional? This is something that we're currently exploring. We know Washington and other states have done something similar. So we're looking at what authority we have to be able to make a similar change so that folks can be conditionally enrolled once they submit their application and don't have to still wait for that waiting period. And happy to let you all know how that develops. Our hope is to be able to get an answer to that in the coming weeks.
Thank you so much, Alyssa. I'm not seeing any other questions in the chat or on Facebook, so I'm happy to share some agency and program updates while we wait for Megan to arrive and talk with us about the Seating Justice grant.
Thanks, Allison.
Yeah, thank you so much. And we can go, there we go. So wanted to make you all aware that we have a new video webinar series on the ELD website. This is for certified school age centers who just got their own rule set for the first time effective this winter. So the video webinar series will walk you through the new rules. It's the first time we've done anything like this, so we are very excited about it. I will put the link in the chat. It's going to walk you through the different rule sets and give you some technical assistance, some tips for how to remain in compliance. So if you have any questions, again, per usual, reach out to your licensing specialist, but we wanted to flag this for you all as a new resource available. In the chat now. Next thing we wanted to bring to your attention is the 2022 Preschool Development Grant Strengths and Needs Assessment. There's a new report available on our website. Some of you may have participated in 2022, giving feedback on what it's been like to be a childcare provider over the past year. So we hope to have someone from the Early Learning Division research team join us at our next information sessions in March to dive into some of the findings of this report, but wanted to share the link with you for now in case you have time or are interested in looking ahead of that next session. one's in the chat now. And lastly, Alyssa talked about this earlier, and if you joined us for our November information sessions, you know we walked through some of these changes, but wanted to summarize again the eligibility expansion for employment-related daycare, or ERDC. So as of January 1st, on average, more families will receive more childcare hours. Students without jobs can receive ERDC if they meet all the other eligibility criteria. Students are eligible for more study time hours, and all ERDC families are now eligible for more sleep hours if a caretaker works a night shift. And in addition to that, there are some changes to authorized medical leave with employment-related daycare. Sorry, computer's frozen. So parents are eligible for more authorized medical leave for the birth of a child without having to provide documentation. ERDC participants are eligible for more leave to take care of a sick child. Applicants for ERDC can be on medical leave for their own condition or their child's, and participants can continue using childcare benefits when on leave to care for someone outside of their household. So with all of these changes going into effect, we know that more families are eligible and we need more childcare providers to offer that care. So ERDC is really working to enroll more participants in the program. I will put another link in the chat to the provider listing form if you're interested in becoming an ERDC provider. We want to kind of help with that application process. And I'll also add an email address to the chat if you're interested in signing up but need some help walking through the process.
Allison, I'm happy to answer a couple of quick questions in the chat. And
thank you.
Then introduce our next speaker. So first, Zakia, really appreciate your questions and suggestions around the provider management platform. We're in the early stage of figuring out what all the provider management platform has to do. So this is super timely and we'll take this back. We'll also be coming back to you all to get ideas like this in terms of what you ideally would like a new provider management platform to do and how we can make your jobs easier through that system. No guarantees, but we always want to know what to shoot for, and we'll work towards that. Can ERDC families receive pay for a 12-year-old that turns 13? ERDC can be used for children older than 12 in certain circumstances. So I would encourage you to reach out to your CCRNR or to ODHS to determine if that child would be able to be eligible after turning 13. Will the need to renew your ERDC application for licensed providers end? Great question, Zakia. As of right now, we are not changing the application or renewal process for ERDC, in part because we want to make sure we can successfully move the program to DELC. But that's something that we're happy to think about changing going forward. So appreciate the question. With that, really excited to introduce Megan Irwin and to talk more about childcare capacity building grant fund. So Megan, I'll hand it over to you. Excited to see you and hear more about this.
Thank you. Hi, everybody. My name is Megan Irwin. Pronouns are she, her. And I'm joining you tonight to just really give you a heads up about a grant opportunity that's opening up in February, aimed at supporting childcare providers to expand capacity. So basically that means expand your existing programs or open new programs. So just here to give you some information, make sure that you know that this opportunity is coming, and to point you in the right direction for where to get more information once it opens. So we can go to the next slide, thanks to the person driving. So, oh, and I should say, I'm here to share this information with you on behalf of Seeding Justice, which is the philanthropic organization that is the administrator for these funds these funds out in partnership with the Child Care for Oregon Coalition. So first and foremost, just want to let you know what the fund is. It's called the Oregon Child Care Capacity Building Fund. And it's a new one-time grant that was created by the legislature and sent to Seating Justice to support childcare providers to expand their capacity. Again, opening new programs or expanding existing ones. We will be, this funding is super flexible. I'll talk more about how it can be used in a minute. But the way that this was designed was really to try and make it as flexible as possible to go toward all of the things that go into your ability to grow your business or open a new one. We are really focused on a couple phases of funding. The first phase that opens in February will be an initial priority application period for providers who have had the least access to grants like this previously, and then we'll do an open application period after that. So let's go to the next slide. As you're thinking about whether or not this grant would be a good fit for you, I want to just share what the priorities for the fund are. As I said, we're going to be opening the fund up in phases. The first phase of funding will be prioritized toward or targeted toward providers who identify as Black, Indigenous, or other people of color, providers to provide services to children in their native language that is not English, providers who do care for children with delays or disabilities, and then providers that provide culturally specific services. So that's who's eligible in phase one. In phase two, anybody who is a childcare provider in Oregon is eligible for funding. I really want to emphasize too that anybody who is a childcare provider in Oregon is eligible for this funding. So licensed providers, registered family, certified center, you're all eligible. Recorded programs are also eligible, and so are registered subsidy providers. Your request has to be aimed around expanding or growing the number of children that you're caring for. But anybody that is a child care provider in Oregon is eligible for this funding. As we are focused on growing capacity, I do just want to mention that there are a couple types of care that we're really focused on wanting to expand and fund through this grant. Would really like to see this funding go toward expanding, again, culturally specific and linguistically specific care, infant, toddler care, swing shift and non-traditional care hours, and then looking to expand capacity in parts of the state where we have really extreme childcare deserts. So that's how we're kind of thinking about priorities. And go to the next slide. So I'm sure as you're thinking about whether this is a fit for you, the question is always, how can funds be used? So this fund can be used for the things that you see here on the screen. As childcare providers, you can apply for funding to support up to 6 months of initial operating costs. And initial operating costs, it's kind of a broad category, but that includes things like the materials and supplies that you need to furnish the classroom, the fees and insurance costs that kind of come along with expanding to a new site or starting a new program. You can also, within that initial operating costs category, request funding to cover staff compensation and benefits for the first 6 months of operation. Just kind of recognizing that when you expand or start new, it takes a little bit of time before you're full. So it takes a little bit of time before you're covering the monthly costs that it takes to operate the program. So this initial operating cost category is meant really provide that startup investment, that startup capital that's needed to get going, whether you're starting new or expanding your program. Funds can also be used for capital improvements. So that one's pretty straightforward. Renovations and repairs that are needed in your home or in your center to meet licensing requirements or other like city or county codes. These funds can go for renovations and repairs that are needed both inside and outside of your location. And the only caveat here is that these funds, the capital funds, cannot be used as the sole source of like purchasing a new building, but it can go toward renovating and repairing a building or a home that you already own or that you're leasing if you have permission from the property owner to do those improvements. The funds can also go toward, if you don't mind going back, the other piece that's relevant to you as providers is that these funds can be used for workforce supports. In our conversations about how to set this up, we've really recognized that a big limiting factor for you all as providers being able to add capacity or even operate to your full capacity that you're already licensed for is staffing. We know there's a massive staffing shortage. It's been very hard to recruit people into the profession. So as part of this grant, you can also request funding to support the workforce. This can be things like covering training and professional development costs for your staff. This can also be hiring bonuses, retention bonuses, things like that to help attract people in or keep them. We recognize that you probably can't or wouldn't want to do like permanent raises with one-time funding, but you can request funding to do bonusing for your staff to try to make saying yes to the job more appealing for a strong candidate or to retain the folks that you already have. So that's how funds can be used. And amounts that you can request will all be available on the website. It's different for each category, and to avoid confusion, I don't want to just throw a bunch of numbers at you, but when I wrap up, I'll let you know how you can get on our mailing list and get connected to our website that will have all of this information on it. In terms of the grant making process, it's a two-step process. We will have folks fill out an interest form for us that is pretty simple. We've tried to keep it relatively easy to fill out on the interest form level. We're really just going to need to know what your proposed project is. In general, how much funding do you think it will take? In general, how many slots do you think that your project will allow you to add to your program? We need a little bit of demographic information and need to know what provider you are. And then at the interest form level, you will also be able to request support and technical assistance you think you might need to complete the full application. After interest forms come in, there are 3 things that can happen. One, your proposal will get moved to the full application stage. We'll be invited to complete a full application. That will be for more complex, more expensive projects. Like after we sort of learn what folks want, you know, if you're requesting funding to do kind of a big construction project, we will need some more information to better understand that. But we don't want to put you through a whole bunch of paperwork on the front end. So we'll get the interest form, then we'll invite people into a full application process with technical assistance and support. For small projects, $10,000 or less, request $10,000 or less, our steering committee has the ability to just approve those without having to go through the rigmarole of a full application. So that's the second thing that can happen post interest form. And then the third thing is it's possible the project could be declined if it winds up being something that doesn't meet the criteria for how the funds can be used. If invited to submit a full application, we'll be working with you to let you know exactly what additional information we need, exactly what kind of detailed budget we need, and we will be pairing applicants with technical assistance support, so that it doesn't have to be a frustrating experience, but you actually have somebody sort of navigating the application process with you. Go to the next slide. In terms of timeline, as I said, we're going to have a first application period for our priority providers. That opens February 6th. The letter of interest or the interest form will be open from February 6th to March 3rd. If you fall into that pool, we really encourage you to just get your materials together and submit as soon as possible. We will meet to review interest forms on March 16th. And then folks from that first pool will be invited to submit full applications with the deadline of April 14th. Then we'll have a second phase that's open to all eligible providers. The interest form for that opens March 20th and will run until April 14th. Then we'll go through a similar process of reviewing those forms, inviting folks into a full application period, and then granting out all funds by June. Whether you fall into the priority application period or not, I would definitely encourage you to sign up for our list so that we can, once our website's live, we can direct you to the website. There you will be able to see the questions that we'll be asking. You'll be able to see, there's a whole packet of information that you can download as providers that walk you through exactly how funds can be used, exactly how much you can request for each type of funding, and the kinds of questions we'll be asking, so you can start to gather your materials and be ready to apply as soon as the pool that you're eligible for opens up. I think that's all that we had. If you want to be on the mailing list to get information about this when it goes live, this is the email address to email. Jot it down. I also would love, Alyssa, if you and your team could like send these slides out and really highlight that email address for folks. Starting on January 23rd, we'll be starting to send out information to our mailing list of, okay, the grant goes live in X number of days. Here is the website you can go to download the packet with information. Here's where you can go to get questions answered. So if you think that you're at all interested in this opportunity, make sure to shoot an email to this email address here to let us know, so that we can make sure that you're on the list and getting information and in the know when the opportunity opens up. And I'm sure there's questions. I'm happy to do my best to answer them. This is a pretty exciting, we're really excited to be able to make this funding available for you all. And again, I've tried to keep it really flexible, tried to have the grant amounts be big enough that you can really like do significant work with them, and have a feeling that the funds will be expended quickly. But we're excited to be able to bring this forward to you. And yeah, I'm happy to see if there's any questions. I'm not sure how you guys do Q&A on these.
Thanks, Megan. I can read them to you if that's
Sure.
easier. So we have one question. You mentioned recorded programs. This question talks about RS licensed providers that expand. Are you talking about programs that expand from becoming recorded or license exempt to a registered family, or expanding their capacity up to 3 children or however many children there?
It could be either. You know, if you're a registered subsidy program, you know, you only can do the 3. But if you're at 1 and you need some support to get to 3, put in an application. You know, that limit of 3 kind of taps you out really fast with your capacity. But certainly if you're a registered subsidy provider caring for 1 or 2 children and you want to request support to help reach that cap, I would encourage you to apply. And then similarly, if you're a registered subsidy provider and you've been thinking for a while, I would like to make the jump to registered family. Maybe what would it be like to have 10 kids in my care? But you need that investment to help you get there. This is a good grant for you. So it could be either. It's really, it's hard to answer with more specifics than that without knowing, a person's goals for themselves.
Right.
But yeah, it's just to increase capacity across all of those settings.
Excellent. Thank you so much. Next question. Do you know if there are other states with similar grant programs that inform about what kind of increase in capacity that providers could hope to see?
I don't know. I mean, I think every state in the country is like putting funding into childcare capacity right now. When we were designing this, we tried to stay really focused on the problems that we've heard from providers here in Oregon. So it's kind of designed around that. But did remind me to say that providers have to be located in Oregon and care for kids in Oregon to be eligible for this. I think probably everybody here is, but I forgot to say that earlier.
Important clarification. Thank you. Can a provider only apply for one phase or all phases?
I would say apply for the phase for whatever phase you're eligible for, because the truth is, it sounds like a lot of money, but it's not, and it's going to go fast.
Okay.
So if you're eligible in phase one, and for some reason we don't move you forward, that would be a conversation, I think, with our TA team about why. But I would just apply for whichever phase you're eligible for.
Great. And I know you addressed this, but there's a question. Any idea of how much money we're talking about for a certified center? 5 figures, 6 figures?
Yes, I can. Yeah. I mean, 6 figures. And the reason that I just was silly. It was silly of me. I didn't jot it all down. So there's the 3 uses, right? There's capital construction, startup costs, and workforce support. And the maximum amount for each of those 3 categories is different. But the cap for certified center, the most you can apply for certified center is $500,000. And the cap for home-based is $100,000. So it is significant. There's some variance there depending on whether you're asking for capital money or startup money or workforce money, but it's hefty amounts. Let's say that.
Thank you.
Yeah. Now, you also are welcome to ask for less. Like if you're like, I actually just need to put a fence around my yard so that I can finish up the licensing process and get open. Like those kinds of requests are okay too, but there are some big limits on this one because we recognize some of what's been preventing people from being able to open a new site is just not having access to that really hefty amount of capital funding or initial startup investment that's needed.
Thank you.
Yeah.
There's another question related to license exempt or recorded programs. If they are not currently participating in ERDC, are they still eligible?
Recorded programs, yes, and then it's registered subsidy.
Great.
So yeah. And I see here Zakia is asking where the max funding types per license will be shared. It's going to be on the website for the fund. There's a packet of information that has tons of detail in it for folks to go through. And that will be live the last week of January. And so if you sign up for if you email this email address that's here on the screen and let us know that you want to get on that email, that's how we'll be able to let you know that it's up. And I'm also going to bug Alyssa and Allison and the ELD team with the link to that and ask them to send it out to you all too. So we're going to do everything we can to make sure that everybody knows when the application is up, when the full packet of information is up. It will be in English, Spanish, simplified Chinese, Russian, and Vietnamese. And then if you or a friend need the information in another language, all you have to do is let us know and we will translate it to that language for you.
Excellent. Thank you so much, Megan. And we did have a couple questions about the recording from tonight and these slides. They will be on the Early Learning Division website by the end of the week. It might be as early as tomorrow. I put the link in the chat, but it's oregonearlylearning.com/provider-info-sessions. That's where you'll find all of the recordings and slides from past sessions as well. So they'll be there, and we'll definitely work with Megan to make sure that this information is included in our childcare updates and social media as well. We know this is a great opportunity for programs. And Megan, we have one last question here from Facebook, and thank you so much for the time. The person asks, could it cover rent as your building capacity served in the expansion process in a school?
Yes, that would fall into that startup category, the startup costs.
Great.
Yeah.
Thank you very much, Megan. We'll
course.
capture all of the Q&A from tonight. If there's anything else that we've missed in the last couple minutes, we'll make sure we get that over to you, but we can hand it over to Karina for closing out the night.
Thanks again, Megan, for joining us. Lots of great information. Hopefully folks' questions were answered. And again, we will make sure to post these. We do our best to try to post the video, the recording on our website. So sometime tomorrow, perhaps by the end of the day, that's kind of usually our goal. Depends on our communications team as well, but you will be able to find it there by end of week at most, to be able to go back and watch the recording. And we will also go ahead and upload the slides there. It is great to know that the application will be available in many languages. That is a really, really important tool for all of us. For additional updates and we just want to remind you to subscribe to the childcare provider updates. Here's just a little visual of how to do that. If you go to our website, you will find the box that says subscribe for news and updates, and we will make sure to reach out. These go out about every 2 weeks. It's kind of the pace that we'll be seeing these for now. And we will have our Spanish provider information session tomorrow for anyone who is here, for anyone who might want to share this information. The link is on our Facebook page to register for that. And that is an entirely all in Spanish session for those whose first language or native language is Spanish. Before closing, you'll see a survey link, and we just want to put that out there. Appreciate your time, your support, and your questions here tonight. Just want to get your feedback on how this was received by you, what we can do best, and also an opportunity there to enter suggestions or thoughts for additional topics that you'd like to see. We'll move forward this year with these provider information sessions every 2 months. So our next session will be in March, and you can look out for that invitation through the childcare updates, through our social media as well. And remember, the recording is actually on our Facebook. I was getting a little confused, but you can actually find the recording on our Facebook page tonight. So you'll be able to go back, rewind, and watch that. But you will also be able to find that uploaded on our website by the end of this week. So there's a couple of avenues and a couple options that you are able to access the recording by. I believe that is all that we have tonight, unless anyone else from the team wants to hop on. But if not, we again thank you for joining us this evening. We look forward to having you again in March. And please reach out if there are any additional questions. We have a wonderful evening. And again, thank you for all of the work that you do and for all of the care that you provide. We really, really appreciate it on behalf of the Early Learning Division.